Bismillahirrahmanirrahim. The quote for today is nutrition is not just about eating, it's about learning to live. Today we are going to discuss about the iodine deficiency disorders. I am Dr. Mohammed Vasgil, PGR of the Community Medicine Department from King Edward Medical University, Lahore, and my supervisor is Professor Saira Afzal. So the learning outlines of today will be introduction to iodine, causes of iodine deficiency, disease related to its deficiency, prevention of the disease treatment, deficiency at national level, and recent updates. By the end of this presentation, participants will be able to describe about the iodine deficiency disorders, its causes, along with the prevention and treatment. Now, introduction about the iodine. Iodine is an essential dietary mineral for neurodevelopment among children. The thyroid hormones thyroxine and triiodothyronine, that are T4 and 3 respectively, contain iodine. In areas where there is little iodine in diet, typically remote inland areas where no marine foods are eaten, iodine deficiency is common. Iodine deficiency occurs when the soil is poor in iodine, causing a low concentration in food products and insufficient iodine intake in the population. It is common in mountainous regions of the world where food is grown in iodine-poor soil. There is total 50 to 20 milligram of iodine in human body, primarily concentrated in thyroid tissues and hormones. 30% of iodine is distributed in other tissues, including the mammary gland, eyes, gastric mucosa, choroid plexus, arterial valves, the cervix, and the salivary glands. Iodine deficiency resulting in goiter occurs in 187 million people globally as of 2010 data. Certain areas of the world, due to natural deficiency and unavailability of iodine, are severely affected by iodine deficiency, which affects approximately 2 billion people. It is particularly common in Western Pacific, Southeast Asia, and Africa. Among other nations affected by the iodine deficiency, China and Kazakhstan have begun taking action. Intake only of locally grown food in Central Africa can cause iodine deficiency. In primary hypothyroidism, decreased production of thyroid hormones by the thyroid gland causes a compensatory increase of thyroid stimulating hormone. The increased level of thyroid stimulating hormone is the earliest sign of iodine deficiency induced hypothyroidism. Secondary hypothyroidism is caused by the pituitary disorders causing decreased TSH release and decreased T3, T4 levels. Since iodine is used to make thyroid hormones, and iodine deficiency means body can't make enough of them, leading to hypothyroidism. This is the pictorial diagram showing the mechanism of the hormones. Thyrotropin releasing hormone is released by the hypothalamus of the brain, which acts on the pituitary gland, which helps in releasing thyroid stimulating hormone from the pituitary. The thyroid stimulating hormones then acts on the gland to produce T3 triiodothyronine and T4 thyroxine. Now, the risk factors associated with the iodine deficiency are low dietary iodine, selenium deficiency, pregnancy, exposure to radiation, increased intake plasma levels of nitrogen such as calcium. Sex, it more common in women, smoking, alcoholism, oral contraceptive, percolates, tries, thiocyanides, and age. For different types of iodine deficiency at different ages. Symptoms associated with iodine deficiency may include fatigue, increased sensitivity, cold, constipation, dry skin, weight gain, puffy face, hoarseness, and muscle weakness. These all are the symptoms that are caused due to hypothyroidism, decreased functioning of the thyroid gland. The physical symptoms that may appear is the swelling in front of the neck, hair loss, dry, flaky skin, feeling colder than usual, and changes in the heart rate. Now the goiter. A low amount of thyroxine, one of the two thyroid hormones in the blood due to lack of dietary iodine to make it, give rise to high levels of thyroid stimulating hormone, which stimulates the thyroid gland to increase many biochemical processes. The cellular growth and proliferation, swelling, or hyperthyroidism of the thyroid occurs in return. Goiter presents the classical sequelae of chronic iodine deficiency. When the iodine intake decreases, the secretion of the thyroid stimulating hormone is enhanced for the reason to increase the uptake of available iodine. Thyroid stimulating hormone concentration in turn stimulate hypertrophy and hyperplasia of the thyroid, resulting in increase in size of the thyroid gland. Initially, goiters are characterized by diffuse homogeneous enlargements, but over time, nodules and subclinical hyperthyroidism often develop in adults. In mild iodine deficiency, levels of T3 may be elevated in the presence of low levels of levothyroxine as the body converts more of the levothyroxine to triiodothyronine as a compensation. Some such patients may have a goiter without an elevated TSH. The introduction of iodized salt since the early 1900s has limited this condition in many different countries. So the symptoms include the goiter, difficulty in swallowing, trouble breathing, and the symptoms associated with the hypo or the hyperthyroidism. Goiter is usually harmless if it is unattractive. Nevertheless, nodules may cause tracheal obstruction or impair the function of the laryngeals. When surgery is required or elected, the risk of surgery in the local setting may be considered and it may not be negligible. Now, the congenital iodine deficiency syndrome, that is cretinism. Cretinism is a condition associated with iodine deficiency and goiter, commonly characterized by mental deficiencies, deafness, frequent disorders of stance and gait, stunt growth that are also all associated with the hypothyroidism. According to WHO in 2007, nearly 2 billion people had insufficient iodine intake, a third being of the school age group. The conclusion is that the single most preventive cause of intellectual disability is that of iodine deficiency. No, these are the features that are consistent with the cretinism. These are retarded physical and mental development. Ossification of bone is delayed. Tooth development is poor. Tooth eruption is delayed. Permanent neurological damage is evident. Clinical, the infant is dull and apathic. Body temperature usually below normal. Physical, the tongue is enlarged. Skin and lips are thick. Face is broad and puffy, and nose is flat. It also affects the physical growth as it clearly retards growth and development. And iodine deficiency individuals frequently are shorter than iodine sufficient peers. It also affects the reproduction as hypothyroidism can interfere with the ovulation by preventing egg release. What is the mechanism of the iodine deficiency in reproduction? It decreases the egg release. It can also affect embryonic development, increasing the risk of miscarriages. Premature delivery, low birth weight, and diminished fetal mental capacity are also associated with the condition. Hypothyroidism is treated through thyroid replacement therapy. The condition can usually be managed by taking a single daily pill of thyroxine. The iodine deficiency and skin manifestations, as illustrated in the diagram, this is a condition known as myxedema. This can affect the skin, causing swelling and redness, and it is mostly an autoimmune disorder. Myxedema is also used to describe dermatological changes that occur in hypothyroidism and occasionally hyperthyroidism. Now, what is myxedema? A person with myxedema may notice swelling in their face, legs, and tongue. Their skin may also become dry and pale. Other symptoms of severe hypothyroidism can include intolerance to cold. Facial expression become full, the voice is hoarse, speech is slow, eyelids drop, and the eyes and the face becomes puffy. Mixed edema coma. It is also known as mixed edema crisis. It is a rare life-threatening emergency situation that represents severe hypothyroidism with physiological decompensation. That condition usually occurs in patients with long-standing undiagnosed hypothyroidism and is most often precipitated by infection, CVD diseases, heart failure, trauma, or drug history. The symptoms may include hypothermia, hypotension, bradycardia. These all the three are on the lower side. Decreased pulse pressure, normal systolic pressure, elevated diastolic pressure. The pulse pressure decreases due to rise in the diastolic pressure. Decreased respiratory rate, periorbital puffiness, macroglosia, pores are thinning here. No, the effects of hypothyroidism and the centers and its effects on the cerebrovascular system. The symptoms may include the decrease in heart rate, constriction of blood vessels, and increased blood pressure, retention of fluid and edema, and increase in cholesterol levels. Severe cases of hypothyroidism can cause heart failure and even death. Prevention of iodine deficiency is through fortification. Mostly, fortification of salt is done in many parts of the world. The goal in the prevention of iodine deficiency disorder is universal salt iodization. It is a program this program must take into the account possible losses between the point of manufacture, import, and the consumer's table. The best indicator for monitoring the impact of iodine deficiency disorder control program is that salt may be iodized. N- uh, uh, the best indicator for monitoring the impact of iodine deficiency disorder control program is neonatal hypothyroidism. Sorry, this code missing the neonatal hypothyroidism. Salt may be iodized in several ways, including dry mixing, drip, or spray techniques. Generally, the iodine is sprayed or drip fed on the salt as it flows down a mixing screw conveyor. If the salt is finely ground, the iodine may be added. In some instances, international agency, particularly UNICEF, has been instrumental in introducing USI, that is Universal Salt Iodization and Facility Producer, by supplying the machinery required for the iodization process. The customary level of fortification in the range of 20 to 50 milligram of iodine per kg of salt. There are the five conditions that can destroy through the food fortification, as in goiter can be prevented by adding iodine in the salt. Now, the iodized bread. Three programs in New Zealand, Russia, and Tasmania have used bread as a vehicle for distribution of iodine. Water has been successfully used as a vehicle for prevention of iodine deficiency disorders. A celastatic cylinder consisting iodine has been used in boreholes in several African countries to achieve some success in raising community iodine intake, but the many associated difficulties have prevented. An ambitious program to introduce iodine into irrigation water in the desert areas of Western China is a widespread use. Now, the supplementation of iodine that may be drops or the iodine tablets. Drops of legume solution have also been used in schoolrooms. Tablets of salts of iodine, sometimes disguised with the chocolate, have been dispensed intermittently. Recently, there has been renewed interest in intermittent change in classrooms using tablets or drops containing iodine. Iodated oil. Iodated poppy seed oil has been widely and successfully used in the prevention of these disorders since its introduction in late 1950s in New Guinea. Needs may be met for a year or more by a single dose depending upon its size and route of administration. These mixtures have been used both intramuscularly and orally in doses varying from 2 to 3 ml. Iodinated oil has been proved to be the most successful, but it requires a skilled team, availability of disposable syringes and needles, and carries an attendant risk of infection. Nevertheless, iodinated oil has a well-defined role in international campaign against iodine deficiency disorders. It's usually treated with eating more food containing iodine, using iodized salt, and taking iodine supplements. People with hyperthyroidism are usually treated with synthetic form of thyroid hormone, which they will need to take for the rest of their lives. Standard treatment for hypothyroidism involves daily use of synthetic thyroid hormone levothyroxine. This oral medication restores adequate hormone levels, reversing the signs and symptoms of hypothyroidism. Some treatment drugs are levothyroid, levoxyl, some thyroid, and unithroside. If the goiter has become so big that it's stretching or compressing the nearby structures, or it has become unsightly, you may need surgery to remove the thyroid gland. Pakistan is a country with history of iodine deficiency. McCarrison firstly identified the region as severely iodine deficient in 1908. Since then, almost all the studies report is a higher goiter prevalence and iodine deficiency, particularly in KPK perforates. Pakistan finally adopted the Universal Salt Iodization Program in 1994. These efforts resulted in a decline of iodine deficiency up to 50%. However, the estimated improvement in iodine deficiency disorders eradication is not uniform and may be overestimated. No, this is the comparison graph of the let me check. Junior iodine concentration distribution in the Pakistan National Nutrition Service in 2001 and 2011, as it is clearly depicted in the picture that the universal iodine concentrations are significantly lower in 2001 than as compared to 2011. Now, the time for the recent updates. An article in the first article that was included in it is effect of chronic or high iodine intake on thyroid function and fertility. This article got published in 2019. The important points related to this article is that thyroid autoimmunity micronutrients play a pivotal role in human body. Their deficiency toxicity lead to many life-threatening conditions. Among them, iodine deficiency was one of the situations prevailing globally since decades. It causes thyroid disease and disrupts fertility. To overcome this deficiency, University Health Coverage Program was established in 2004. This prolonged and unchecked early starter utilizing beyond limits not only corrects the deficiency but also created problems such as hypothyroidism, thyroid autoimmunity, or the compromised fertility. Epidemiological studies show a high number of fertility issues globally, and unchecked early salt utilization may be one of the factors having a contribution in it. The slowing progressive pattern remains unchecked and needs to be addressed to ensure the provision of the scale that efficiency. This review provides a link between higher iodine intake and its effect on thyroid and fertility. The second article is from Pakistan, whose title is Multiple Geochemical Factors That May Cause Iodine and Selenium Deficiency in Gilgit-Baltistan region of Pakistan. This article got published on 2021. Its substract states that deficiency of the micronutrients iodine and selenium are particularly prevalent where populations consume local agriculture produce grown on soils and low iodine and selenium availability. This study focus on such an area, Gilgit-Baltistan in Pakistan, through geochemical survey of iodine and selenium fractation and supplementation in the distillation of water and arable soil. Iodine and selenium concentration in water range from 0.01 to 1.79 microgram per liter, respectively, which are smaller than the levels reported in smaller mountainous areas in other parts of the world. Iodate and selenate were the dominant inorganic species in all water samples. Average concentrations of iodine and selenium in oil water were 685 microgram per kg and 2009 microgram per kg, respectively, much lower than the global average of 2600 and 400 microgram per kg, respectively. The reactive fractions, soluble and absorbed form of iodine and selenium accounted for less than 7% and less than 5% of their total concentration in soil. More than 90% of reactive iodine was organic. Iodine was the main inorganic species. By contrast, 70% and 40% of soluble and absorbable selenium respectively were present as organic species. Inorganic selenium was mainly selenite. Very low distribution coefficients for iodine and selenium suggested minimal buffering of available iodine and selenium against leaching losses and plant uptake. The geochemical characteristics such as low availability of iodine and selenium in glyphosate, which may be reflected in locally grown crops. However, further investigation is required to ascertain the status of iodine and selenium in the Gilgit-Baltistan food supply and population. No time for the MCQs. I request everyone to participate actively in this session. First MCQ is iodine is an essential dietary mineral for neurodevelopment among children. The goal in prevention of iodine deficiency disorders is universal salt iodization. Which of the following could lead to iodine deficiency? Whether low intake of fruits and vegetables, intake only of locally grown food in Central Africa, insufficient caloric intake, inadequate sunlight exposure, or consumption of phytogenic foods. Kindly try to answer. It's an easy.
A.
It's be local in intake only of locally grown foods in Central Africa. As the Central Africa soil is deficient in iodine, so it can lead to iodine deficiency. UNICEF has been instrumental in introducing USI, that is Universal Standardization, and have assisted producers by supplying the machinery required for the iodization process to prevent iodine deficiency disorder. The best indicator for monitoring the impact of iodine deficiency disorder control program is whether the prevalence of goiter among school children, urinary iodine levels among pregnant women, neonatal hypothyroidism, iodine level in soil, or the thyroid hormone levels among adults.
B.
Yes, it's C. No, it's C, neonatal hypothyroidism.
Yes.
The best indicator for universal salt iodization for iodine deficiency disorders is neonatal hypothyroidism. C answer is the correct option. A male baby born in the setting of Lady Winter Hospital through C-section. After 4 months, the mother presented with a complaint of yellow-colored skin along with lethargic baby who's having delayed developmental milestones. Mother was deficient from iodine throughout the pregnancy. Iodine deficiency in a pregnant woman could result in whether cretinism, cryptocortism, chronic hyperthyroidism, thyroiditis, or pneumonia.
Mm,
Yes,
A.
it's a cretinism.
A.
Fourth MCQ, the brain in the control center of the nervous system and it is located in the skull along with heart, liver and lungs. It's one of the vital organs of the body. These are all dependent on the certain minerals and enzymes. Which of the following body parts is strongly dependent upon the trace amounts of iodine, whether liver, thyroid gland, pineal gland, thymus or the renal gland?
B.
Yes, it's B,
B.
thyroid. Yes, thyroid gland. When the progressive enlargement of the multinodular goiter causes symptomatic tracheal compression, the typically preferred treatment management in the otherwise good risk patient is whether radioactive iodine treatment, thyroid hormone treatment, iodine treatment, surgical resection of abnormal thyroid, or observation and regular monitoring. For, which is
B.
which is the correct option?
B.
B.
Uh, the correct option is D. That is the surgical resection of thyroid, abnormal thyroid. As in the stem, it states that when it becomes so enlarged that it compresses the trachea, then the preferred option will be surgical resection. Sixth MCQ is woman presented to OPD with the complaint of dry yellow colored skin of lower legs along with itching. She was diagnosed as having myxedema. After all investigations regarding myxedema, the following are true except solar edematous look of the face, impotency, amenorrhea, BMR increased by 30 to 45%. Uh, Basal metabolic rate decreased by 30 to 45%. Dullness and the loss of memory. All are true
C.
except one.
C.
C.
Yes, C. BMR increased by 30
C.
to 45%. The explanation regarding this MCQ is that the basal metabolic rate in hypothyroidism is slow, not it is increased. So it is C option. Food fortification or enrichment is the process of adding micronutrients to food. It can be carried out by food manufacturers or by government as a public health policy. Salt fortification with iodine is an example. A customary level of fortification for salt is in the range of whether 10 to 25, 15 to 25, 25 to 35, 20 to 50, or greater than 50 milligram per kg.
B.
Yes, it's D 20 to 50 milligram per kg. A couple is trying to conceive for 3 years, but the results are still negative. On the lab results, women show an FSC level of 8.5. LH levels are also within the range. Where the thyroid profile shows decreased level of T3 and T4. Hypothyroidism is their diagnosis, and it can cause female infertility by all of the following steps. Infertility caused by interfering with the fallopian tubes, whether interfering with the ovulation, interfering with cervical secretion, interfering with progesterone production, or interfering with ovulation.
E. A.
Yes, A is the correct option as we have to choose the wrong one. So it doesn't have to do with the fallopian tubes. Ali is 13 years old boy, resident of Khyber Pakhtunkhwa. He is showing stunned growth. On checking the average height of the all children in that area, it was found to be less than average for the most of the children. In endemic area of iodine deficiency, along with salt fortification process, which of the following should be given to school children? Whether legules drops, Grisdol drops, retinol drops, mephiton drops, or vitamin A drops.
Two.
Yes, it's legules drops. The last MCQ, a woman presented to me hospital dermatology OPD with a history of dry skin, loss of eyebrows, especially the lateral margin. She also complains of decreased energy and fatigue. She is resident of quieter endemic area. On her lab, thyroid profile was done. Physician has a suspicion of hypothyroidism because of iodine deficiency. Which of the following is the earliest sign of iodine-induced hypothyroidism? Whether TSH raised and the T3, T4 is the same. TSH decreased and the T4 is decreased too. TSH decreased and there is no effect on T3, T4. TSH is same and the T3, T4 decreased. T4 is decreased and the T3 decreased later on.
It would be C. TSH decrease, but no effect on T3 or T4.
It's TSH raised and T3, T4 remains the same. As the explanation is that when the hypothyroidism results, there is T3 and there is a decrease in T3 and T4 production, which then acts on the pituitary to form more T and more TSH. So the levels of TSH will be raised in the blood. So the correct option is A. This is the key of my MCQs, and this is our YouTube channel by the name of Community Medicine King Edward Medical University, where all the presentations and activities of the department are uploaded here. And thank you very much for today's presentation.
Thank you very much. Very nice presentation, Dr. Aves, on a very important topic that is again one of the very prevalent disease, especially the hypothyroidism and Hashimoto's thyroiditis. The hypothyroidism is usually the sequence of Hashimoto's thyroiditis, and we know that there are many inflammatory markers and oxidative stress that are related with Hashimoto's. So, whenever we are presenting hypothyroidism and we are not talking about Hashimoto's thyroiditis, it seems as if something is incomplete. Hypothyroidism is mostly present as a subclinical disease and as a preventive medicine and a community medicine specialist. We should always concentrate on subclinical diseases because they contribute to the greater burden and they also lead to the iceberg phenomena where we are looking at the tip of the iceberg and the huge burden of the disease is lying inside. So the people with hypothyroidism, now we know that there are certain processed foods, ultra processed foods, beverages that are high in sugar like carbonated drinks, and the fried foods like the chicken fries, the potato fries, and everything that is fried that can lead to the oxidative stress, and that oxidative stress can lead to Hashimoto's thyroiditis and hypothyroidism. With the time, the cases of hypothyroidism, they are rising, and each day more and more cases, they are becoming evident. Obesity, we know that is also one of the symptom of hypothyroidism, as well as obesity is strongly linked with the causation of hypothyroidism. So it is a vicious circle. Hypothyroidism leads to obesity leads to hypothyroidism, and the oxidative stress increases. So cutting back on the different types of products that leads to the oxidative stress, for example, the goitrogens can lead to the decreased incidence of hypothyroidism. You must be wondering what is goitrogens. These are the substances like cruciferous vegetables, cabbage, etc., that can interfere with thyroid hormone production. So the diet, especially the cruciferous vegetables, again, we have seen that there are certain people who are using broccoli instead of the cabbage. They are actually having a good health, and they are switching the high goitrogens with the low goitrogens. Broccoli is one of those that has a very low risk of causing goiter or hypothyroidism. Similarly, the cooking practices and the genetics, they also have a very important role. And we know the goitrogenic foods, they also increases the risk. And cooking practices like overcooking, frying, they increases the goitrogenic activity. And even those foods that are not goitrogenic, they are changed into goitrogenic foods. So in the take-home messages, we have to take care of all the subclinical cases of hypothyroidism. We have to early identify the Hashimoto's thyroiditis. We have to make it a point that the iodine should be present in the food, and the food quality is not destroyed by overcooking, by overheating, by frying, and the goitrogens, they should be avoided. So these are the few points that is important in today's discussion. After this, I also want to highlight another important point. As Dr. Naila and Dr. Aves, we all are discussing about the assignments of our new students. Dr. Naila, I would recommend, are you with me, Dr. Naila? Dr. Naila, are you
Yes,
with me?
ma'am.
Okay, thank you.
Yes,
Dr.
ma'am.
Naila?
Yes, ma'am.
Okay. So we have two new MPA students in the group, and we have 3 MPhil students here. So I would recommend that the batches of Ahmad would be shared by the one of the MPA student, and batches of Amna should be shared by the other MPA student. And for MPhil, those students who are FCPS, like Marina or MPhil, if they are going on maternity leaves, they should be replaced by MPhil students, right? So we have to pair Ahmad with one of the MPA student and Amna with another MPA student. The basic responsibility of completing the research batch work is on the primary tutor, and the primary tutor would be the senior person in the group of training, right? So if we are training Dr. Ahmad with another MPA student, then the senior would be Dr. Ahmad, and similar is the case with others. So if Marina is trained with MPhil student, Marina would lead as a primary tutor. So I would request that before proceeding on summer work, you should sit together and decide about these things, right? So Dr. Naila, you should today discuss this further with MPH and MPhil students, along with Dr. Amna, Dr. Ahmad, Dr. Marina, and all other, and Dr. Isma, all other who are uh, having their batches, and we should attach another person